Hi, good morning, good afternoon, good evening. From wherever you are joining, you're most welcome to this webinar, which topic is Follow the Money, Closing Data Gaps in Health, Research and Development Financing for Healthy South Africa and Africa. We have an excellent group of speakers who have given us their time and will be presenting in order. And thereafter, we will have a panel discussion. So, again, it's really a pleasure to welcome every one of you to the SAHTAC webinar. And the whole goal of SAHTAC, which really stands for Strengthening Africa's Health Technologies Advocacy Coalition, and it's a network that is a coalition of a group of people and organizations that really seeks to categorize action on health research and development in terms of research through a very coordinated effort amongst various organizations. But we cannot start the webinar today without recognizing that today is World TB Day. And of course, we're aware that as we converse on the discussion today, it is important for us to reflect on the 2026 theme of World TB Day, which is Yes, we can end TB, led by countries, powered by people, and the global call to accelerate the efforts to end TB. South Africa, as we know, has long been at the forefront of TB research and innovation, from diagnostics to treatment regimens, demonstrating the critical role of health research and development in saving lives and strengthening health systems. However, ending TB and addressing other pressing health challenges does require not only scientific excellence, but strategic, transparent, and well coordinated investment in research and innovation. So today's discussion, Follow on the Money, is therefore highly relevant. If we cannot clearly track, align, and optimize our investment, we really risk slowing progress towards disease eradication. So our key message as we listen to our speakers is, if we cannot track and align investments, we cannot maximize impact or accelerate progress towards disease eradication. So it is with great pleasure I kick off with our first speaker, who is Jonathan Devon, who's the Director of Public Finance from the Health National Treasury. He will actually be sharing with us a presentation, and he's given us an excellent bio sketch, which includes 12 years of experience in health and financing and budgeting. And so, with your expertise and experience and skills, I hand it over to you, Jonathan. Thank you.
Thank you very much, Nita. I hope my slides are visible and that everyone can hear me. And good afternoon to everyone, and thank you so much for the invite and opportunity to speak to this webinar. So I'll speak a little bit about transparency in health and R&D funding, but also more specifically about the national budget process for the health sector, including health research, and then transparency and accountability in public spending. So this is the presentation outline. As I'm already mentioned this in my sort of opening sentence, so I'll dive straight into the content of the presentation. So the first thing to say is just that the budget process is really a combination of top-down and bottom-up. So and there's a negotiation between those two processes, right? So the top-down approach is basically looking at what funding is available and what are the priorities of government. But then also there's a bottom-up where we engage with departments and institutions and see what the needs are, what the priorities are. And you kind of have to negotiate those two processes. It's a process that is coordinated and led by the National Treasury and Ministry of Finance. But it's really a multi-departmental process with representatives from other departments that sit on the technical committee on the budget, which is the committee that evaluates budget requests from the department and recommendations from the various teams within the National Treasury, and the Ministers' Committee on the Budget, also called the MinCombud. So, I mean, in terms of top-down, obviously the most critical one is really the fiscal framework, looking at what are the revenue projections, what are the what is the fiscal space for spending, whether it's additional spending or maintaining existing spending, or in some cases, unfortunately, in the past, the focus has a lot been on reducing spending. And the reason for that is that South Africa has for several decades, until recently, run very large budget deficits. And that has led to a massive increase in spending on debt service costs, basically paying interest on government debt. And that debt service cost spending, as you can see in the row there, it's about 400 billion, or just over 400 billion per year, as estimated in the most recently tabled budget, which is equivalent to more than 20% of revenue. So because of that sort of escalation in debt service cost, the focus in recent budgets had really been to balance the books, achieving primary surplus, and a primary surplus is when non-interest spending is below revenue. So that's why you hear a lot in recent years about budget reductions and so on. We think we are at a place now where we have reached a point where the outlook is stabilized. But obviously, with everything that's happening in the world right now, everything is a little bit predictable. But at least based on the assumptions in the budget tabled, we are in a fairly healthy place, and we don't foresee, at least based on those assumptions, that there will be major further decreases in budgets. In fact, there was some additional funding allocated to the health sector, and including to the SAMRC for replacing PEPFAR funding that was withdrawn, or NIH funding rather, that was withdrawn. So looking at the budget engagements that happened during the budget process, and this is mainly the bottom-up process. So the budget is tabled in February, but the process leading up to that tabling is really starts in June, when we issue guidelines to the departments. Institutions then in July submit their budget proposals, narratives, and workbooks, and then we then have a series of engagements with each function group. One of the function groups is health. So we have bilateral meetings with the National Department of Health. We usually have one meeting with the Department of Health and the public entities, including MRC and NHLS, which are, of course, very highly relevant for health research funding. We have a function group meeting where we include provincial health departments and provincial treasuries. And in some cases, we also have a 10-by-10 meeting where we have the heads of treasuries and health departments meeting. And this then, based on what we hear in those meetings and what we as a health team within the Treasury thinks is reasonable recommendations to take forward to the TCB, we make those recommendations, present them, and then that emanates then in the medium-term budget policy statement, which outlines the broad budget priorities for the upcoming budget. And then what follows from there is really like figuring out the nitty-gritties of the budget and preparing the budget publications and taking those priorities into a little bit more detail. And how the health sector gets funded. So I won't speak to this in detail, but broadly speaking, there are three main funding mechanisms for the health sector. So the first is the equitable share, which is unconditional transfers that are not ring-fenced for the health sector. There's a health component in it, but it's not ring-fenced, and that's from the national treasury to provincial treasuries that they allocate to the various sectors. So that funding source accounts for about 80% of health sector expenditure, and 20% roughly of provincial health expenditure is from conditional grants, which are for specific purpose. That's ring-fenced funding that goes via the National Department of Health. It's for things like the HIV programs, infrastructure, tertiary services, etc. And then the last one is the national vote, which is the National Department of Health, which includes its transfers to public entities. So that's where most of the health research funding flows, at least the research funding that is within the health sector. Of course, a lot of it is in with the higher education and other sectors as well. This shows public health expenditure per capita. You'll see that public health spending, and this is in real terms, so it's adjusted for inflation. So you'll see that it peaked really in COVID when large additional allocations were made to manage the pandemic. But after that, because of the economic situation that emanated from it, we've had to cut budgets, and public health spending per capita has then declined. But so this is not actually updated with the latest budget estimate for 20 in the recently tabled budgets, but as I mentioned, we think that there is a more or less a stabilization of spending per capita now. Now, focusing on health research, how that gets funded. Obviously, that's spread across many different institutions like the Department of Health, MRC, NHLS, other science councils, universities. So because of this, there's no single budget process for health research. It's basically managed in the different function groups. A large part of it is in health, but obviously there's a education function group as well. The South African Medical Research Council tends to be the main vehicle for targeted health research allocations, and they receive about 1 billion, or just over 1 billion rand allocated via the National Department of Health. But obviously, many of these institutions also rely heavily on their own contract revenue or grant revenue from donors and other funding sources. And importantly, from National Treasury side, we don't tend to make sort of detailed prescriptions of how funding for research should be used. A lot of those allocative decisions are made at the institutional level, so within these organizations. So although we don't have a budget line or specific budget process for health research, what we have introduced recently, and it's in very, very early stages and only at a pilot stage, is that we have introduced what's called a budget tagging exercise. And the most recent one of these is for science, technology, and innovation. And it's initiated and jointly coordinated between the Department of Science and Innovation and National Treasury. And the most recent budget is when it was introduced. And the National Department of Health is one of 3 pilot departments. And it's basically a template issued to all these departments where they must tag budgets for science, technology, and innovation. So and it's disaggregated by 3 gaps that have been identified by DSI, like scientific and technological services, scientific education and training, and R&D. And then it's different pillars and interventions, of which some are specifically for health. We don't have any reliable data emanating from this yet. We need to strengthen both the breadth, including more departments in this, but also the quality of data. So it's the first time that we did this. So reviewing at what the department submitted, we can see that there's definitely need for some refinement. But hopefully, eventually, this can become an important mechanism for better tracking of R&D spending. So what we do have in terms of estimates is from the R&D survey that is done by DSA, StatsSA, and the HSRC. And looking at this data that I pulled from this survey, it shows that national R&D spending in medical health sciences is estimated to have grown by 7.6% per year since 2014-15 to 23-24. And it makes up about 24% of total R&D spending in the most recent year. Approximately half of this, as you can see in the row in italics there, is from public institutions. So it's basically the total, and then I've here excluded business and nonprofit. There is an international benchmark that has been committed to by African governments of allocating around 2% of health budgets for research. And if you look at those estimates and taking that as a percentage of total health expenditure, we are more or less on par with this. But this obviously depends on what you include and what you exclude. This excludes health research spending that is outside of the health sector as well. So in higher education, for example. So if you would only include what's inside the health sector, that percentage would be significantly lower. Looking at the South African Medical Research Council expenditure trends, Spending increased by almost 12% between 2022-23 and 25-26. We see somewhat more moderate growth going forward, but it's still above inflation projections. So we do have a real budget growth projected for health research. The strongest growth we see here is in core research and innovation and technology. And looking at where that revenue comes from, historically, the majority has come from government, but in the forward projection, you can see at the very last column there that the non-tax revenue, which is their own contract revenue, actually exceeds government revenue. And that is mainly because of their strong revenue collection or their fundraising. It's actually not that MRC has been subjected to large budget cuts. We've actually tried to really protect them from budget cuts, even when all of the other public entities have been cut. Because we see research as such an important priority, we have managed to protect SAMRC. And one of the ways that we have done that more recently is that we allocated money in 2026 for the replacement of foreign donor funding. And that was part of a co-funding arrangement that the MRC had set up together with the Bill and Melinda Gates Foundation and Wellcome Trust, whereby government allocates 400 million and those two philanthropies contribute 100 million each. So we did one tranche of this through emergency allocations provided for in the PFMA, but then we've also allocated funding over the MTEF for this, as you can see in the template, or in the table. There's quite a lot of research going on also in the NHLS. There is a declining trend in the NICD and NIOH, which you see in these two rows, the surveillance of communicable diseases and occupational health, as well as in NHLS's core research function. It's in total about 900 million is spent on this in the budget projections. So turning a little bit to transparency and participation and oversight. So South Africa participates in what's called the Open Budget Survey, which is a part of it's an international organization that ranks and scores different countries in terms of their transparency and participation and oversight of the budget process. South Africa scores and have always scored quite high on the transparency. So we are now globally number 4. I think we used to be number 2 or shared even number 1 together with New Zealand, but we've dropped slightly to number 4, but still in international comparison, performing very well. Similarly, we perform fairly well in oversight as well, which is about how well the legislature and the Auditor General oversees budget execution. Public participation is an area of improvement, but that, as you see in these small numbers to the bottom, which shows the global averages, that it seems to be a case for many, many countries in the world, and South Africa actually performs slightly better than the global average. So what are some of the things that we do to ensure transparency? I think probably the most important thing that Treasury does is we publish a lot of information on our website. So it's the budget review, which shows, the overall budget. It's estimates of national expenditure, which shows expenditure and budgets by department. We publish the budget legislation. We publish Section 23 report, which is quarterly expenditure report. We have an online portal for budget information called Vuleka Mali. And then there's equivalent publications on the provincial side and importantly, a lot of this information is available in Excel format as well. And then there's also information.
I'm going to ask you to wrap up slowly. Thank you.
All right, I'll do so. And then there's also information published by each department and public entity, like annual performance plans and annual reports. Accountability mechanisms. This is my second last slide. So each national department needs to report their spending to the National Treasury on a monthly basis. And on a monthly basis, we look at that expenditure, we send written feedback to the department, we query if there's things that is unclear. We also report on a quarterly basis to Parliament's Appropriation Committee and present it to them. Obviously, an important accountability mechanism is that Parliament can summon ministers and departments if they need clarity on issues with regards to their finances. We receive quarterly reports by national departments on conditional grant expenditure. Public entities are mainly accountable to their executive authority, so which is the ministers that they report to. So they must, for example, approve their budgets and major transactions or business decisions. But they also submit quarterly reports on spending to the National Treasury. Obviously, the Auditor General plays a very important role in accountability as well. Another area of accountability is that we publish performance indicators, so not just financial indicators, but performance indicators in our budget documents. So to make it clear to the public what is intended to be achieved with the funding that is allocated. And a new development is also that Treasury publishes a procurement dashboard, which draws on procurement from a procurement system where you can look at all the government departments and look at individual contracts and spending by supplier. So just in conclusion, despite the constrained fiscus that I outlined, survey data show that public investments in health research has actually increased in real terms in recent years. And health research remains an important priority for government. We have tried to protect particularly the MRC from budget reductions, despite reductions being applied across most of government. There's no single budget for the health research, but so it's spread across many different institutions. So that's why we are trying to introduce this budget tagging system, and hopefully that can yield some results in future years. And yeah, budget transparency is as well as accountability mechanism is a key priority for the National Treasury, and there is a wide range of data and documents available on our website. Thank you so much. I'll stop there.
Thank you very much. Can everyone hear me? Thank you very much, Jonathan, for the transparency and contributing to the first goal, which is improving transparency of health R&D financing. We're going to move along with the presentations, and I'm encouraging all our participants, thank you for joining, to please note your comments and your questions on the chat. We will definitely have time for discussion. This is a 1.5 hour slot, and so therefore we will make time for call to action. So it gives me now great pleasure, and it's a very good segue to move to our next speaker who has left an important meeting. So welcome, Michelle Mulder, and thank you for joining us. Michelle is the Executive Director at the South African Medical Research Council. We've heard quite a bit about it, and she oversees and leads the grants innovation and product development at the South African Medical Research Council. So, Michelle, I hand over the session to you. Thank you.
Thank you, Nita, and good afternoon, everybody. If you can just let me know if you can see my slides.
We can see your slides, and it's in great order. And
thank you.
Go ahead.
I'm going to be talking about how we as the MRC are strengthening coordination across different funding streams, and also how we specifically make sure that our investments in health research speak to our national health research priorities. I think Jonathan gave a very good overview of how the MRC is funded and where that funding comes from. But just to maybe step back a bit, so the MRC, as you probably all know, is a science council established by an Act of Parliament, Act 19, from 1991, but actually the previous act was from 1969. And we are there to advance the nation's health and quality of life and address inequality by conducting and funding relevant and responsive health research, capacity development, innovation, and research translation. So with that mandate in mind, our core functions are to conduct research, to fund research, to develop research capacity, to facilitate innovation, science communication. Obviously, we need to make sure the outputs of research are disseminated, and we also use the outputs to advise government. And then all of this is underpinned by a central administration or support structure, which helps us do the work that we do and keep the lights on. And then everything underpinned by partnerships. And you'll see throughout my presentation how partnerships are so key to everything that we do. So we support research and innovation in the health space through a number of different mechanisms. We've got our intramural research units, of which there are 10. They are, as the name suggests, within the MRC where we conduct research in different areas. We've got our platforms, which conduct research, but are also service platforms. We've got our extramural research units, which are joint ventures with universities. So we've got around 26 EMUs at the moment, conducting research programs under a very wide range of health priorities. We've got our grants, innovation, and product development unit, which I head, which manages all the external grant mechanisms of the MRC, strategic funding partnerships, and then also our innovation support mechanisms. And then we've got our research capacity development programs. So this includes scholarships, fellowships, career awards, and this is specifically aimed at increasing the research capacity of specific individuals, but also institutions, particularly the HDIs. So we see ourselves as the largest local fund of health research and innovation in Southern Africa. You saw some of the figures in the previous presentation, but in 2024-25, our total revenue was around 1.4 billion. And we pride ourselves on spending less than 20% of our budget on support. So most of this money actually goes towards research and innovation activities. I think also importantly, and again, it was mentioned by the previous speaker, we use our baseline public funds to leverage substantial additional funding. So more than half in some years of our funding comes from external sources. And what that does is it substantially increases the pool of funding that we have available to invest in health research and innovation in the country. You also heard about the awards from Treasury with co-funding from 2 other funders, where we played a major role, and in fact currently playing a major role in relieving the impact of the US funding cuts. So we were really, really grateful for the support from National Treasury through the emergency funds, which enabled us to bring in another 200 million altogether from Gates Foundation and Wellcome Trust to be able to pick up some of the pieces that were left when US funding was withdrawn under various bodies such as CDC, NIH, and others. So this is just a snapshot of some of our strategic partnerships, and these really enable us to bring in money, as I mentioned, but also to align much better with other funders as to how we support health research and innovation in South Africa, specifically around our national priorities. So you see our 2 main departments there, National Departments of Health and Science, Technology and Innovation. We also work very closely with the Technology Innovation Agency. And then our international funders would be, for example, ANRS in France, the NIH in the US, CIHR in Canada, DBT in India. So those are kind of sister bodies who are very much like the MRC, and we partner with them to fund joint programs. And in many cases, that funding comes actually into South Africa to invest into projects. As an example, MRC UKRI is one of our strong partners. For every rand that we put into that partnership, we get 8 rand from UKRI MRC. So a very nice, well-leveraged funding partner there. So how do we determine our research priorities? So we all know about the quadruple burden of disease, which is really what drives what we invest in. The MNCH, non-communicable diseases, infectious diseases, and violence and injury. But and then we invest in those sort of areas that are listed in that circle: disease mechanisms, population health, health systems, etc. But we also look so we look at the burden of disease, we look at the National Health Research Committee priorities that come out, and there they take this quadruple burden and they delineate into slightly more detail. We do a lot of stakeholder engagement. So we actually convene national research priority setting exercises ourselves, usually in particular areas. So we've had one around HIV, cancer, digital health, and so on. But then we also leave ourselves open to be able to respond to emergencies or pandemics and other emerging opportunities. And I think importantly, I showed you the different partnerships that we're involved in. Each one of those, when we bring in money from externally to invest into South Africa, it's aligned with South Africa's national health priorities. So we then have a very strong say in determining the investment areas. This slide depicts how we are currently in my unit through the external grant mechanisms and programs addressing the main priorities. So if you look at the column down the middle, is the different priorities, and then to the left of that is the different programs, and each one might have a different funding partner, a different focus. So some are more discovery research and some are more innovation research. And then on the right hand side, we also do cross-cutting. So we look at domains and ecosystems: drug discovery, clinical trials, vaccines, medical devices, and so on. So we have a range of programs addressing all of these areas. So how do we improve coordination and alignment? So we run the African Health Research and Innovation Funders Forum. This is where we coordinate health funders that fund into Africa in the health space. And the purpose of this ARIF is to align funding priorities, promote cooperation, prevent duplication of efforts, but also to encourage and support the establishment of collaborative and coordinated funding initiatives. So it started back in 2022 with a grant from the New Venture Fund. And this grant basically allows us to run these events. So it's around running a main meeting every year. We started off just with a South Africa focus, then we moved to SAHTAC, and then we were asked to actually expand to the whole of Africa. So we've got a core group of around 45 funders who fund into Africa. They range from philanthropic funders to governments to similar organizations to the MRC and so on. So we bring them together once a year to discuss funding priorities within the continent, who's doing what already and how we can avoid duplication and look at key funding gaps. And then we also hold satellite meetings in particular areas, so drug manufacturing, climate and health, and so on. Last year we ran one on diagnostics. And those are really drilling down into these particular focus areas to see how we can, what's already happening on the continent, who's investing in what, and how we can better coordinate. And then just finally, our other funding forums. So apart from the ARIF, which we run, we also participate in GLOPED-R, which is looking at coordinating funding around pandemic response. And in fact, we host the African Regional Hub of GLOPED-R, which is specifically looking at the funders within Africa and how we better coordinate our pandemic response. We participate in the Grand Challenges Funders Forum. So this is all the international Grand Challenges partners. And that really also helps us to bring in money from those partners into projects within South Africa, from those partners and the Gates Foundation. We participate in the CEPI Medicines Countermeasures Funders Forum, again, looking at pandemic response. The Essence Funders Forum. This one is particularly useful in that it not only looks to coordinate funding between the different funders, but it also is a way to jointly look at issues that different funders face. So things like, how do we measure impact? How do we build research capacity? And so on. So it's and things like funding. So it produces practice notes on equitable contracting for funding, overhead models, and so on. So it's a very useful group to be part of in terms of coordinating and aligning with what other funders are doing around the world. And then finally, nationally, we are strengthening as the MRC. We're strengthening our coordination, collaboration with groups like the NRF, TIA, and HSRC. So we've met with them all individually and are crafting joint projects and programs to make sure we align better, particularly in the health space. I attended a meeting last week that TIA organized with all the science councils, which was really a wonderful opportunity for us to strengthen our commitment to coordinating the way we fund research and innovation in the country. So with that, I just want to leave you with the MRC's history and health statement, just recognizing the MRC's historical role in apartheid and injustices, and re-emphasizing our commitment to continued promotion of justice and dignity in health research. Thank you, Nita.
Thank you so much, Michelle, and thank you for contributing towards one of the goals of this webinar, which is to strengthen and coordinate across the various funding streams, and also to ensure that there's alignment, which was highlighted in your presentation. So thank you very much for your time as well. And so this now moves us to our next speaker, who is really going to add value to this discussion. And she is no other than Tivani Mashaba Thompson, who is the Deputy Chairperson of the National Health Research Committee and also the Professor of Diagnostic Research at the University of Pretoria. She's given us a very valuable bio sketch, which we will share, but one of the highlights is her representation internationally in terms of her role as an advocate on non-communicable diseases and focusing on integration with the NHLS. So with that, I warmly welcome you, and please go ahead with your presentation. We can see it in presentation mode. Thank you for that.
Good day, colleagues, distinguished researchers and partners. I am going to put my video on just now. It's just taking time, and it's a privilege for me to address you on behalf of the National Health Research Committee and to speak directly to the community that sits at the core of our country's health and innovation ecosystem. So us as researchers, we are not only generators of knowledge, we are architects of future health systems. So the evidence that we produce, the questions that we ask, the partnerships that we build, they really ultimately shape the policy, practice and guidelines for population health outcomes. So today I want to engage with you and share on our shared responsibility on how we strengthen the coordination and build sustainability, health, innovation, investment systems, while ensuring that our research efforts are aligned with South Africa's national health priorities. So I need to move my slides. They seem to not want to move. The purpose of my talk really is to also share with you the role of the National Health Research Committee and strengthen the coordination and also talk about strengthening the coordination in health research and also building sustainable health innovation investment systems and alignment of research with health research priorities. First, I need to share what our committee is role is, and our committee is a statutory body that is appointed by the Minister of Health under the National Health Act 61 of 2003. And it's tasked with setting and overseeing, as well as enforcing ethical standards for health research in our country, South Africa. Its role includes registering and auditing ethics committees, and as well as developing ethical guidelines and ensuring high ethical standards to protect human participants and animal participants in research. And we have clear objectives, which is to set the norms for ethics and to provide oversight on ethics committees and also advise government and providing counsel to the national and provincial departments of health on ethical issues relating to research, as well as ensure compliance in addressing regarding the functioning of the research committees and also capacity building, promoting and protecting research integrity, and ensure that everyone contribute equally and to help improve the health and well-being of our people. So really, our committee acts as a national leader for ethics and also for ethical matters, and provides oversight on composition, competencies, and also operations of human and animal research ethics committees. So also I want to move on to the issue of research policy and investment gaps, which is an area that I know that our audience is more interested in. So our country, as you already know, has a strong and global recognition in terms of research, and our contributions in HIV, TB, and increasingly our contribution in non-communicable diseases research is well documented and is well respected. But yet, despite our strengths, we have persistent gaps, and these gaps include, the gap between our research and policy uptake, also the gap between innovation and implementation, the gap between funding, decisions, and national priorities. You've heard from Jonathan that they are still cleaning up and they're trying to also assist us in making sure that there is this gap is closed in terms of funding, decisions, and national priorities, and we hope that this will be closed very soon with assistance from his department. So as researchers, many of us have experienced this firsthand. We've experienced high quality. We have high quality studies that do not translate into policy change, and you even go as far as writing up that paper, in synthesizing it into a policy brief, hoping that it will reach the decision makers. But we have that gap is still persisting. We have produced promising innovations that stall before scale up. You work so hard in attract funding and then produce great innovations here in our continent, here in our country, but they did not reach the market. The funding calls do not reflect pressing local health needs in most cases. This is not really a failure of our science, because our scientists are working, our researchers are working. It's a system level coordination challenge, which I think together here we can maybe work on improving. We also have the need to strengthen coordination, and there is a role that researchers can play here. And coordination is often framed as a government responsibility, but it is equally a researcher's responsibility. So strengthening research coordination requires a shift in how research is conceptualized and conducted. This means we need to move from isolated projects to pragmatic systems-orientated research, from disciplinary silos or working in isolation as disciplines, to working in interdisciplinary spaces and conduct transdisciplinary collaborative research. We need to also move from end of project dissemination to continuously engage stakeholders. So as researchers, this requires national action. We need to engage policymakers and also not just disseminate at the dissemination stage, but also during problem formulation and study design. And we need to collaborate across sectors, including clinicians, economists, engineers, social scientists, and all health research specialists, as well as health professionals. We need to participate in national platforms and advise structures where research priorities are discussed. So coordination can help improve or can help improve research translation and ensure that the research that is conducted is not just sitting in our desktops or just stays in the high impact journals and not be translated. So really, it's important that there's an alignment in research with the health research priorities. And this alignment is not about limiting science inquiry. It's about minimizing relevant maximizing relevance and really minimizing the challenges that I've just highlighted and ensuring impact. So it's important that we, as researchers, we engage, as I said, with policymakers. I think my slides are moving a little bit slow. So South Africa's health priorities are very clear and really they address the burden of HIV and TB, responding to a rise in non-communicable diseases, and also tackling maternal and child health challenges and strengthening health systems overall. So, however, what we have identified is that it's important that alignment and awareness is implemented. So we need responsiveness and national agenda in terms of research. We need context-sensitive study designs that reflect real-world systems and also focus on implementation and sustainability, not only the focus on efficacy. So when we ask ourselves, we always constantly ask ourselves, who will use our research, and also who will which policy will our research influence, and what are the pathways to implementation. There's also a growing need to strengthen our evidence. So the need for us to contribute to the evidence ecosystem. So evidence synthesis capacity is key to ensure that we contribute to the evidence ecosystem. So evidence needs to be synthesized continuously using systematic reviews and meta-analysis, and also through policy briefs, so that we can contribute to the evidence ecosystem. We need data integration systems linking clinical, laboratory, and population level data in order for us to contribute to this evidence ecosystem. These are critical for informing investment decisions, ensuring that research contributes to all the entire system, and then ensure improved health outcomes. We also need to rethink research funding and investment systems. Let us turn to a topic that directly affects all of us: the funding. Many of the researchers in this I wanted to say in this room, but we are not in this room, in this webinar, experience this challenge in funding. And many researchers operate within funding environments that are competitive and fragmented, and also that are short-term in nature, and they are often externally driven. And we need a bit more of internal systems, maybe at the national level. And while this landscape has enabled important scientific advances, it also creates challenges. So we know that depending on external funders, you really, if their policies change on the other side, we then have a detrimental challenges that also affect our populations. So we need limited continuity of research programs, and while we've seen the challenges that are there, they include limited continuity of research programs at population level. We have seen misalignment with national priorities of the external funding programs. We also have noticed insufficient support for implementation and scale. So as a research community, we need to actively contribute to reshaping our funding systems nationally and be less dependent on external funding systems. So from projects to programs, we need to advocate for a design that is long-term, that is pragmatic, that really addresses priorities of our country, and also integrate multiple disciplines and methodologies, and include clear pathways for policy and implementations. In implementation, we also need to embed implementation research. So implementation research must become a critical and not just it needs to be like very much central and not be simply empirical or an empirical component of our health research. And this means studying how interventions work in real world settings. It means us putting more efforts in identifying barriers and facilitators to scale. It means we need to generate evidence that is directly actionable. And we also need to engage with innovative financing models where researchers also play a role in shaping innovative financing approaches. This means participating in public-private partnerships as we conduct our research. It means contributing to design of outcome-based financing models, and also generating evidence that demonstrate value for money as well as impact. And in our case, impact also means showing that improved health outcomes. And is increasingly funders are asking, not only what works, they also want to know what works at scale and at what cost. So we need to also make sure that we are able to answer those questions. We need also to build
Tavani,
a culture
sorry to
of
interrupt. I'm going to ask you to wrap up, please. Thank you.
Thank you. We need to build a culture of impact-oriented research to strengthen health innovation systems. We must collectively shift towards culture of impact. And this means that an impact-oriented research culture is characterized by a clear pathway from evidence to action, strong partnerships with health systems and stakeholders, and also accountability for real-world outcomes. And really the role of our National Health Research Committee is really to strengthen the national research priority settings, promote alignment to research health systems, and advocate for sustainability and diversify funding, facilitating and coordinating across the institutions and sectors. So as a direct call to research community, allow me to conclude with 3 direct calls to action for us as researchers. First, let's design for relevance. Let's ensure that our research questions are grounded in South Africa's most pressing health challenges. Let's engage beyond academia. Let's work closely with policymakers, implementers, communities through the research lifecycle. And last, think beyond publication. Plan for implementation, scale, and impact. And really, on behalf of the National Health Research Committee, I invite you not only to be producers of knowledge, but the drivers of change within our health systems. And I thank you.
Thank you very much.
Acknowledge our National Department of Health and also our partners within the committee, including the MRC and DSTI, as well as higher education institutions and partners organizations that contribute to enable us to continue governing health research in South Africa.
Thank you very much, Tivani, for also gently reminding us about the ethics, and the call for action was really well taken, and it's something that the panel, together with members on this group, can look forward. With that, I would like to now invite our last speaker who has been waiting patiently. Patrick, you welcome. Just a little bit about Patrick. Patrick is also from the University of Pretoria, and he's really passionate and an advocate of health systems, focusing on non-communicable diseases, and has extensive experience in terms of public health research. And so Patrick is our final presenter, and I hand over to you, Patrick. Thank you. If Tivani wants to stop sharing, please.
Let me just, I'm trying to go back on the system and stop sharing.
Thank
Share.
you.
Did I stop? Did it stop?
We still seeing it on the screen.
So, I, you are sharing, stop sharing.
There we go.
I
Perfect.
have stopped.
Thank you, Tivani. Welcome, Patrick.
Thank you very much, Chair. Good afternoon to you and to all our listeners. It's a pleasure to join you today on this webinar. My screen should start sharing anytime soon. Moving to.
We can see it. There we go. Perfect.
Okay. Thank you once more, Chair, and it's a pleasure to join this esteemed panel of speakers to address such an important problem in terms of closing data gaps in health and R&D financing. As you rightly started, Chair, is the World TB Day today, and the call to action and the theme is yes, we can end TB. As a diabetes advocate, I'm just wanting to add to the conversation and ask the question whether we can end TB without addressing diabetes. We can see quickly there that according to WHO, there's 400,000 TB cases linked to diabetes every year. And unfortunately, in people with diabetes, there's high increased risk of treatment failures, complications, and the likes. So really on this day, I'm using the opportunity to say, as we are working towards ending TB, let's also be reminded of addressing the increase the crisis that is diabetes in our country. The topic that I will be addressing today is unlocking NCD research, capacity, and innovation in South Africa, looking at it from a strategic prioritization and investment lens. Thank you. You generously introduced me already. I will therefore move straight to the core of my talk, and I'll start with asking a question, whether we are investing where the burden of disease is. We had a brief overview of budget allocation. A couple of weeks ago, the Minister of Treasury, Minister of Finance, gave his budget speech, and already from an analysis of the budget speech, we could see that unfortunately non-communicable diseases that are all rising happily in South Africa doesn't seem to be occupying the high places in the scales of priority in the country. We know that diabetes is the #1 cause of death, and it leads to growing pressure on health system and also our economies. Our people and in communities are really bearing the brunt of this condition. But the question we obviously have to ask is whether there is alignment between the disease burden, what is observed in clinics and health facilities, and the budget allocation, which is quite important as we're having this conversation. Just briefly to situate some of our speakers that might not be familiar with NCDs, we are talking about a group of conditions, including cardiovascular diseases, diabetes, cancers, and chronic respiratory diseases. Usually, they are driven by common risk factors, but often linked to socio-economic and environmental determinants, which is critical to understand because preventing and even managing NCDs goes way beyond the health department. Therefore, it's important that we acknowledge that in that fashion, and the investment should also follow that. Indeed, NCDs are currently accounting for the majority of debt globally, as well as in South Africa. As a country, we have gone through what is called an epidemiological transition, and this slide is attest to it. You can see in blue, this is the number of deaths due to non-communicable diseases. In green is the number of deaths due to infectious or communicable diseases. We can see that since around 2009, 2010, non-communicable diseases have been leading in terms of number of deaths. But this reality is not just observed in South Africa, it's obviously also in Africa and in other countries. I like to share this picture that was taken during a briefing with the Minister of Health in Rwanda. You can see here on your slide in orange, this is the number of deaths by NCDs, and in blue, that's the infectious diseases. So in the countries as Rwanda as well, epidemiologic transition has been observed, meaning it's really becoming an African problem whereby the burden of NCDs and his devastating impact on our populations needs to be really considered. On this next slide, we really want to emphasize the point that unfortunately financing might not be following our burden of disease. You can see on your left the percentage of death in LMICs, including South Africa, and on your right, you will see the budget or percentage of total health funding in 2017 allocated to NCDs. So NCDs represent 67% of the number of deaths, but only 2% of the funding it's allocated. So that's really it's a sad picture here that really explain the reason why we are probably having this talk. And in closing, I just want to remind us of these statistics from StatSA. I still find a lot of people who are surprised that diabetes is the leading cause of death in South Africa. So it's important that we understand that epidemiologically we've shifted away from infectious diseases, and it's now the non-communicable diseases that are affecting our people if we consider the number of deaths as published by StatSA. When we talk about funding, the core challenge is beyond a funding gap, there's always also a prioritization challenge, as already alluded to with, for example, the budget speech and the previous slides. We see that there's limited allocation to NCD research and innovation. Yes, we understand, as indicated by Jonathan from Treasury, that the allocation might not be disease specific, but when the bodies or institutions that receive that funding come in possession of the funding, it's important that the use of the funding follow our disease burden, but that's not the case at the moment. We have also an issue with fragmented funding across sectors and really a weak alignment between research priorities, policy needs, and implementation realities. Why should we care? Why this matters? The delayed innovation in NCD prevention and care obviously has tremendous consequences. It leads to inefficient use of limited resources. We have obviously a weak health system response to the rising burden because obviously of inadequate resourcing. And at the end of that, we need to remember that these impacts on real people. This is in our families, it could be ourselves. I'm sure if we were to run a quick poll in terms of whether among participants there are people living with NCDs, I won't be surprised that the findings will be reflecting the picture that we already show, which is that NCDs are leading in the country. Unfortunately, when we fail with prevention and with management of NCDs, we land with increasing long-term healthcare costs. For example, it is estimated that by 2030, the total cost of diabetes will be about 35 billion rand. So it's really important that we understand that the money that we are allocating for research should be considering that inaction, the cost of inaction is way heavier than the cost of action. In terms of strategic prioritization, it's really mean that we should be moving from passive funding to strategic investment. And again, we welcome this webinar in addressing this topic. It's important that our funding is aligned with the burden of disease, but also that we invest across the full value chain. It's important to look at R&D, but also implementation and scale. It's good that our previous speakers already have alluded to implementation research and the importance of ensuring that there is impact that is felt by the communities and the people on the ground. It's important that we keep in mind that due to limited resources, we might benefit from focusing on high impact and context relevant solutions. It's therefore critical that as we are focusing on creating impact, we strengthen the links between evidence and policy. It's not just enough to run a research program and have a publication. We need to move beyond that. We need to move into the policy space and obviously ensuring that our evidence or the evidence generated is felt on the ground. I would just like to volunteer some of the priority investment areas for NCDs. We spoke about the implementation research, in closing what we describe as the no-do gaps, just briefly to say that there are so many guidelines and policies already around NCDs. For example, the National Strategic Plan for the Prevention and Control of NCDs. But where we are lacking is really to see the impact on the ground, what he described as that no-do gap. So it's important that through implementation research, we really close that gap. But also our primary healthcare system, where the majority of our people, 85%, are receiving care, needs to really be strengthened in terms of ability to deliver integrated, people-centered care. A big gap in NCDs is data and surveillance. Although I've shared some numbers with you, we are still unable to know how many people exactly, for example, are living with diabetes in the country, how many people are having complications, how many amputations due to diabetes are we talking about. All those gaps leads to obviously weaknesses in our funding allocations, and obviously we are not able to track impact and to ensure accountability. So therefore, this should be high up in our priority agenda in terms of strengthening or actually developing strong data and surveillance systems. We cannot talk about NCDs without mentioning community and patient empowerment. Most of the NCDs, as I said, are manufactured in quotes beyond the health sectors, is manufactured in our workplaces, in our communities, and the likes. Therefore, it's important that people are at the center of everything we do. Therefore, community and patient empowerment remain critical in terms of addressing the challenge of NCDs. If we are to say a few words about capacity building, indeed, what I would like to really emphasize here is the third bullet in terms of investing in the next generation of African NCD leaders. Already, we can make a parallel with the conversation that are happening at the continental level about vaccine production and the like. And we can be reminded of what has happened with COVID, when the African countries had to basically rely on leftovers from big powers because of our lack of capacity, because of us not being able to lead efforts in terms of vaccine generations and the like. We are now in a new era whereby NCDs are dominating in terms of mortality on the continent, and there are new technologies, new research methods, new fields that are emerging. We can mention genomics, AI, and the like. If we don't invest intentionally to build the next generation of African leaders and researchers in these spaces, again, once more, Africa and South Africa will be left behind. And this is not only to invest in terms of addressing the health or securing the health of our population, but it's also in terms of benefiting from those investments when it comes to ensuring that those products and those discoveries can be used to generate incomes and even to lead in other parts of the world where similar challenges can be faced. So it's really important that we take it as an investment rather than just an expenditure. So therefore, what we would like to do is to call on rethinking of innovation and understanding that innovation goes way beyond technology. It's about developing new models of care. It's about obviously taking advantage of digital health solutions in a country such as ours, where we have limited capacity in terms of healthcare professionals. Digital health appears to be the right way to go for us to fill some of those gaps. It's about understanding the importance of community-led interventions and obviously policy and financing innovations. So therefore, what we are trying to say here is that innovation must be locally relevant, but also scalable. However, there are very much systemic challenges that should be addressed if we want to ensure that we are meeting our target and achieving our outcomes. For now, the funding streams are disconnected. We've heard already from national treasury, but also from private sectors and donor funding. We appreciate the work of SMRC in terms of bringing all that together and leading in terms of allocation, and as Dr. Mulder says, ensuring that the funding that is coming through is responding to our health agenda and our own challenges. So that's already positive. But we should obviously understand that the fact that we have limited visibility in terms of the total investment available and weak coordination mechanism can lead to obviously underutilization, whereby we are not necessarily directing the funding towards where we could make a strong impact. Therefore, it might be important to explore towards building a unified national platform for tracking funding and financing. What needs to change, therefore? First, my plea as an advocate and an NCD researchers, funding should align and follow our NCD burden. We cannot afford delayed action as it was 20 or 30 years ago, when we had to see so many deaths from HIV before we come into play. By then, there were already a lot of families with where the parents were lost and child-headed households. We don't want to replicate the same 20 years later. And further, not acting on NCDs and not funding adequately our NCDs response will have tremendous consequences, not only on our health system, but also on the national health insurance system that is in the works that we are planning to implement in the coming years.
Patrick, I'm going to ask you to wrap up slowly, please. Thank you.
Thank you very much. We should therefore strengthen transparency and data system, improve coordination across sectors, incentivize private sector reporting, and obviously link investment to measurable outcomes. There is a window of opportunities. South Africa is host to strong research institutions. We mentioned the SAMRC. We can talk about HSRC. We have the academic institutions. We have existing policy commitments. Mr. Jonathan referred to them, the 2% target. But we also have an active civil society and advocacy platforms, and a growing recognition of the NCD burden. Therefore, what is necessary is for that to align and for funding to be redirected accordingly. In closing, Chair, I would like to just mention that strategic prioritization of can lead and transform research capacity and innovation. Investment must be therefore coordinated, transparent, and impact driven. My last word is that aligning resources should be made with resources should be aligned to current evidence, and that is really key to progress and success. Thank you very much.
Thank you very much, Patrick. That was really excellent, and apologies for cutting the speakers down. So this is really a great panel. Thank you all for your time, but most importantly, thank you to our presenters for such eloquent and call for action presentations. You've actually shared a fair number of tasks that we can do collectively. But I'm going to kick off with the discussion and start off with the two people who took the time to put the questions on the chat. And so thanks to William. And so William's question, if you look at the chat, is in our view, what are the primary challenges that have led to the current status, which is not having intentional steps and moving research into implementation? So, William, I don't know if you want to speak more to it, or can any of the panel members go ahead and respond to that question before we go to the next question? I can pick on you. So the question is directed to Tivani. Tivani, are you still there? You mentioned that, according to the chat, the question is there were several publications, but and products have not yet advanced into policy and practice. So, in your view, what are the primary challenges that have led to the status quo, and what intentional steps do you believe can be taken to address this? Tivani, thank you.
Yes, thank you very much. Yes, I did allude to that, and there is. I mean, I agree with our colleague who raised this question. There is that gap for in there is a challenge really in translation of research into real action, and this is really often known as the a knowledge gap or a no-do gap. So this is caused usually by the weak research policy practice linkages. So there's often limited interactions between researchers, policymakers, and implementers. So evidence is produced in isolation, and that's what we have noticed now. And there's no alignment with decision-making cycles, resulting in low uptake. So usually our researchers, as they conceptualize their research questions, they hardly involve communities or even key stakeholders. We tend to really just think of a smart research question that we need to focus on, and then there's limited involvement of key stakeholders. There's also misalignment with national health priorities. So if, research agendas are, research agendas that we normally see, they are usually donor driven or funder driven. So people just see a funding call and then they suddenly decide, I want to focus in this area. So, or academically motivated rather than responding to a local health research need. So then you see that the poor uptake of that research output or research outcome in that instance.
Thank you, Tivani. And William, if you want to follow up, please go ahead on the chat. But the next question I think is targeted to Jonathan, and it's about asking, does the National Treasury have mechanisms to track allocation of health research funding from provincial budgets? So Jonathan, and even if Michelle wants to chime in. Thank you, Jonathan.
Thank you, Lesibana, for that question. Yeah, the short answer is no. We don't have that. There's no dedicated funding stream for provincial health departments that is specifically focused on research. There's a tertiary services grant, which funds a lot of specialists, and obviously they would probably do quite a bit of research as part of their work. There's the health professions training and development grant, which is a trained specialist. So presumably that would also have some contribution to academic work as well. But there's nothing that specifically focuses on research. And I'm actually not sure, how much provinces are involved. I mean, the main responsibility of provincial health departments is obviously health service delivery, but presumably they would have M&E units and teams that do some kind of research as well. It's just that I don't have insight in how frequent that is and how much is spent on it. Yeah, no, I think that's the long and short of it.
Okay, thank you very much. Are there anyone who wants to be bold and put their hands up to ask our panel questions? This is really a good opportunity to have responses to your questions. But while you're taking time, maybe I'd like all the panels to also consider answering this question is, in your view, what is one priority action South Africa should take in this year and the next year? So I will start with Michelle to answer that question, and then Patrick and so forth.
Thanks, Nita. So in my view, we need to be responding to the sort of catastrophic events of last year around research funding. So for us, a priority this year is to say, how do we as a country fill that gap? So what we've done to date is to fill immediate gaps around projects that were already funded and just needed to be seen to completion. But what we need to do now is to say, okay, well, if in the absence of NIH funding, for example, this year, you're going to see a lot of projects, people, even research groups that can't be supported anymore. And we need to maintain that capacity. So we are designing a program around how to replace the NIH funding more broadly. So not to pick up the pieces of previously funded projects, but to see going forward, how do we set a new national health research agenda that we can support that would have been supported with US funding. And this is where we particularly want to thank National Treasury also for their ongoing commitment and for putting this as a line item in the future budget of the MRC. And that's, what we really need to plan for starting this year. In fact, starting next month with the new financial year.
Thank you very, very much, Michelle. And being biased because I'm with the MRC as well, is there has been call for action and funding opportunities being given for projects to complete, and we encouraging people to take that up. Patrick, same question. Your response in terms of, everyone's listed priorities, everyone's listed actions, but we have limited resources, limited budgets, limited people to take things forward, right? So what would be your number one priority for South Africa to take this year and next year?
No, thank you. My number one priority, as stated in my presentation, will be to start off to respond to NCDs and diabetes as a matter of urgency. I would like to also contribute to the funding question. I think when we look at countries like Singapore, we've limited mineral resources, but that have developed so much wealth. It was because of the investment in STEMs and engineering and those kind of skills. It's important that our leaders understand that shift that should happen also on the continent. This shifting burden of diseases, these funding challenges with the US funding and all that, it's really created a strong opportunity for us as Africans to understand that These should be our priority. We should empower our people and we should invest heavily so that instead of us being consumers of research and investment done elsewhere, we become producers of those innovations and we become actually leaders because the burdens and the challenges that we are faced in terms of NCDs, a lot of other countries are facing the same. Therefore, solutions that will be developed in South Africa can easily be imported on the continent, but also beyond, and obviously bring revenues. So it's important that if we have this shift, we are not just spending money, we are investing. I think that would be my emphasis that the policymakers should understand that this is really investing into something that can lead to great wealth in the future.
Thank you very much, Patrick. And I'm not seeing any additional questions, so I'm going to persevere and ask comments from both Tivani and then Jonathan on the same question, please, before I wrap up. Thank you.
Okay, thank you. So my suggestion is that we need to rebalance the national health research funding model towards implementation, scale up, and impact. So what this means in practice, it means we have to ring fence funding for implementation and scale, and meaning that there need to be an allocation for a defined proportion of public research funding, specifically for late stage translation, for health systems integration and also real world effectiveness studies. We also need really end-to-end research pipelines. We have a lot of innovators in South Africa, but our discoveries are not well funded. We need to see the funding that's more funding for our discoveries, innovation. I'm in health innovation, so I really want to see more funding in that, so we can be self-reliant, not and limit the reliance on importing the innovations. We have the scientists here. We train them, we put money into that. We need to fund them and also fund research for their validations of the innovations, fund research for implementations of these innovations, and the scaling up of these innovations, and the evaluations of these innovations while they're being implemented in our countries to ensure that we have the sustainable implementation of the innovations in our country and ensure that improved health outcomes that we need to see. Thank you.
Thank you, Tivani. And we do have a question on the chat, and I'm going to encourage people to respond, but let's hear from Jonathan.
Thank you. Yeah, I think I share similar sentiments with Michelle. Obviously, one of the major challenges that that oversee the health budgets at the moment are worried about is the withdrawal of donor funding. So share her sentiments of the importance of trying to look at other sources of funding and so on, and try to manage that situation. And I think as part of that, critical is also to make sure that we maximize what we have or what we achieve with the funding that we do have in terms of improving efficiency, improving productivity with the existing funding sources. But also, as many people have alluded to throughout the session, prioritizing the research where we will have the most impact. I think the other thing is of course also the for us as National Treasury and for us as a government to improve our tracking of what is actually spent on research broadly, including health research. Hopefully this budget tagging mechanism can gain some traction, and maybe that can also be rolled out in provinces eventually, so we will get a better answer to the question that was posed in the chat earlier. Because at the moment, as we say, we have to rely quite a lot on survey data that is a couple of years time lag. So to inform policy, it's better to have more recent information and more sort of directly from the financial systems. Thanks.
So thank you very much, and I hope that question about do we think institutions are conducive? In my opinion, I believe we are. And with that, I'd just like to use the next 2 minutes to say thank you very much, Patrick, Jonathan, Michelle, Tivani, for your excellent presentations. We hope you're going to share your presentations with Sakile and team. And really to say that while we commemorating TB Day, the issue is not about diseases, infectious and non-infectious. It's about us collating our ideas and strengths and skills to address health in the nation and in Africa. And we know that this panel has alluded to how this can be coordinated, integrated, but we believe strongly with each of you, your institutes, the organizations you represent, we can make this more efficient and more effective. Your positive remarks, Jonathan and Michelle, on funding and addressing some of the gaps is really, for me, very, very positive in moving the right direction, and we need to persevere. And lastly, just to say that in South Africa and in Africa, together with organizations like SAHTAC, AMREF, AMA, ARIDA, we are able to address some of the continental regional issues around health, linking it to things like mental health, environmental health. And so we see the capacity and skill. So with that, I wish all our participants and speakers a wonderful week to move ahead. We will follow up with the call for action on this and give you progress on this and possibly call you back for another webinar on this to say where we are and how have we moved forward. So we wish you well as you commemorate TB Day, but really my personal belief is we need to celebrate all days equally and not, we must stop the issue of TB, HIV days. That needs to stop, and we need to do something about it because we alienate people who are not linked to those diseases, and we make one better than the other. So on that note, thank you again. Have a wonderful day, a wonderful week. You can send messages and questions, panelists and other members, if there are ideas you have for SAHTAC, and we will take it forward. Thank you very much. And thank you to SAHTAC for organizing this. Bye, everyone.
Thank you, Nita.
Thank you all.